Hey, Miss Brandon Cupcake Williams. So we have some discharge teaching to go over before you can go home. Just going to go over a few things. So first, diet. Adequate nutrition is good for your body to heal. You want to eat foods that are high in fiber, like bran, broccoli, cauliflower, and fruits to help your bowel movements become more regular. We also want you to eat foods that are rich in calcium, like dark green leafy veggies, milk, and yogurt, and plenty of water and sugary juices to help satisfy your thirst and keep you hydrated. We want you to avoid soft drinks, coffee, tea, and alcoholic beverages. For your activity, you're just going to gradually increase your daily activities till you're back to your normal routine with frequent rest, no lifting, pushing, or pulling for the first 2 to 6 weeks as instructed by your doctor, and do not drive until you're released by your physician. For breast care, your breasts and nipples may have changed or grown in size during your pregnancy. So, wearing a well fitted, supportive bra day and night may be more comfortable as your body adjusts to these changes. Wear breast pads until you stop leaking, which may occur for several weeks to months. You can also apply ice packs between feeding to ease discomfort. So, if you decide not to breastfeed, you want to wear a well fitted, supportive bra for at least 3 to 4 days following the delivery. We want to refrain from stimulating the breast and nipples. So, that means no pumping, no letting the newborn suckle, no massages, heat, or water, like when you take a shower, face away from the shower. To help alleviate engorgement, you can apply some cold compresses, like a wet frozen towel, cold packs, or ice packs for 15 minutes at a time, every hour as needed. But don't apply these directly to the bare skin or it could cause some injury. For breastfeeding tips, your baby's mouth should form a tight seal. The lip should be against the areola, not the nipple. The baby's lip If the baby is suckling incorrectly, slide a finger between your baby's lip and your breast to break the suction gently, reposition, and try again. And you should nurse for as long as the baby wants, which is usually 10 to 30 minutes. At first, your newborn will probably want to nurse many times in 24 hours, though not for very long. It's important for the health of your breast that you have your infant feed from both breasts every feeding. So, some good signs of nursing is hearing your baby swallow without a clicking sound, seeing movement above the baby's ears, it might even wiggle, and not seeing dimples in your baby's cheek. You and the baby should be calm and relaxed during the feeding. You should feel gentle tugging at the nipple, but no pain after the first few minutes. If you do feel pain, that may be the baby's not sitting right or the tongue does not extend past the lower jaw. Just remove the baby and begin again. Right, for hygiene, wash your hands frequently as you're caring for yourself. To prevent infection, we always want to wipe from front to back after going to the bathroom and clean your bottom with warm tap water using your peri bottle after you pee or use to go number two. It's important that you change your pad frequently. So every time you go to the bathroom, you're going to want to change that pad. For bleeding, vaginal flow will decrease in amount from bright red to pink or brown to a yellow or cream color. Your period may occur as early as 6 weeks to 2 months after the birth of your baby. For bowel movements, avoid constipation. Okay, you can take a mild laxative or stool softener until you've returned to your normal bowel movement pattern. To avoid constipation, we're going to increase your fluid and fiber in your diet, like we talked about earlier. If you wish to do any birth control options, we're going to talk to your healthcare provider. You may choose to obtain birth control before resuming intercourse. As for sexual activity, nothing should go into the vagina for the first 6 weeks after you leave. Intercourse should be avoided until bleeding has stopped or you feel physically and emotionally ready. So, some warning signs to report to your healthcare provider immediately: pain, redness, warmth, swelling, drainage, or a foul smelling discharge from the incision, or it begins to open, such as like anywhere if you had a C section or in a laceration. Any discharge from the vagina that has a bad smell, a severe headache or blurred vision, or any sort of visual vision changes. If you have a temperature over 104, or if you feel feverish or you have the chills. If you have any thoughts of harming yourself or your baby, if you have pain or burning sensation, redness, warmth, or swelling in the legs, if your breasts are painful, swollen, hot, tight, itchy, or you have some sore spots with redness or red streaks or any flu like symptoms. Sharp pains in your abdomen, breast, or chest, trouble breathing, dizziness, or faintness, crying spells or mood swings that feel out of control. If you're unable to feel like you if you feel like you're unable to empty your bladder or urination is painful, difficult, or frequent, or if you have difficulty with the bowel movement. And then if you ever feel like or need a call, we have our hotline for domestic violence or abuse. It is 1-800-96-ABUSE. For safety for your baby, sleeping is a big section. So, sleeping, we want your infant on his or her back to sleep. We want to use sleep clothing, such as a one piece sleeper instead of a blanket. Do not let anyone smoke around you or your infant. We're going to use a firm mattress and a safety approved crib covered by a fitted sheet. Car seats and other sitting devices are not recommended for routine sleep, and we don't want to use pillows, blankets, or any pillow like bumpers in the infant's sleep area. Wedgers and positioners should also not be used. We want to keep soft objects, stuffed toys, or loose bedding out of the sleep area. The baby should sleep in the same room as the parents, but not in the same bed. And we don't want to cover the head um, or overheat the baby. So you already have a bulb syringe, and we want to keep it near the infant at all times. This is to clear the baby's nose or throat if necessary. Clean the bulb syringe well with warm soapy water after each use and allow it to dry. For hand washing, just wash your hands before you hold your baby. Car seat, all infants are required by law to be in a car seat when a car is in motion. Children should be placed in a child safety seat according to state laws. And for the home, the use of outdoor announcements is not recommended to announce the birth because they call attention to the presence of a new baby in the home. Question any unfamiliar person visiting your home or inquiring about your baby after discharge. Do not use home monitors or commercial devices marketed to reduce the risk of sudden infant death syndrome. So, some behaviors that you might see in your baby crying, it's a normal response for your infant to cry. So, the most likely causes for crying are hunger, the need for a diaper change, or needing to burp. You should burp your baby after each feed. So, some calming techniques you might want to try include feeding, changing the diaper, gently rubbing their back or tummy, walking with your infant, rocking, skin to skin, or giving your baby a pacifier. It is never okay to shake your infant. And if you get frustrated or angry, just put your infant in a safe place, take a break, and call a friend. Sleep patterns, babies require a lot of sleep. You should be waking your baby at least every 3 to 4 hours for feeding, and then you should place your baby on his or her tummy each day for supervised tummy time. This is going to strengthen their neck and their belly. For diet, if you're breastfeeding, you should breastfeed 8 to 10 times a day per your baby's cues. Positioning, hold your baby close to you while feeding. Your baby needs to be cuddled, and skin to skin time is recommended. After feeding, hold your infant upright over your shoulder while gently patting or rubbing his back for him to burp. If you do formula feed, um, your baby is receiving a Similac or NFL diet. If your baby sleeps longer than 4 to 5 hours and misses a feeding, wake your baby up to feed them. The baby will generally take about 2 to 3 ounces per feeding after the first few days, and he'll need to eat every 3 to 4 hours. The same way, we're going to feed him, keep him close to you, be cuddled. You don't want to prop your baby up to and your bottle up to feed your baby. Burping, it's again, we're going to burp them for the formula feeding, we're going to burp them every half ounce of formula. Then after feeding, we're going to hold them up right over our shoulder while patting and rubbing their back to burp. Alright, so we're gonna go over some things you might see on your baby. He might have a rash. It's completely normal for your baby to develop a rash on their skin. It appears with these small red circular areas with a white dot in the middle. It is okay. There's no treatment necessary. It's gonna resolve in about a week. We don't want to put any lotions, powders, or perfume soaps on them. Milia are these like pearly white bumps that are normally on the face, especially around the nose. They're going to disappear within 1 week. Again, they are perfectly normal. And jaundice, it's a common occurrence with newborns. Your baby might have yellow coloring on their skin. It'll start to in the face and go down towards the toes. If the baby appears more yellow or jaundiced in the next 24 hours, then you want to call your primary care provider immediately. For your infant care, bathing, your baby's going to need a sponge bath or will need to be sponge bathed until that umbilical cord falls off. So we want to use a soft washcloth, paint, and plain water to wash your face, the baby's face, and then bathe them from head to toe, saving the diaper area for last. And you can use a mild infant type of soap on the baby's body. So with the cord care, we want to keep that umbilical cord dry and clean. So to clean it, we're going to use with warm water and soap when it's spoiled. Inspect the cord and the surrounding skin with diaper changes and notify the pediatrician if drainage or discoloration is noted. The umbilical cord is going to fall off within 2 weeks. So for diapers, 1 to 2 wet diapers are normal for the first day or two of life. Then we're going to expect to have 6 to 8 diapers, wet diapers of pale urine every day. Over the next few days, your infant's bowel movements will begin to change from a yellow-green to a mustard yellow and will soften with consistency. Your baby should have at least one bowel movement every 24 hours. You may want to keep a record of infants' wet and dirty diapers to keep a track on how often they're going. For genitalia, if for your female baby, we always want to wipe from front to back and clean all creases and folds to prevent any diaper rash. Then we're going to pat dry and put on the diaper. It's normal for girls to have a white or pinkish discharge, and secretions are normal and will gradually disappear. For your uncircumcised male baby, we're always going to wipe front to back, clean all the creases in the folds to prevent diaper rash, pat dry, and put on that diaper. If he is circumcised, again, we're wiping front to back, cleaning all the creases and folds to prevent diaper rash, pat and dry, putting on that diaper. You can also use Vaseline to the circumcision with every diaper change for 24 hours. The head of the penis is going to appear red and then we'll go have a yellow sticky-ish film. It's completely normal. If you see any bright red bleeding or green discharge, then you're going to want to contact your healthcare provider. The plastic ring method of circumcision does not require dressing. The ring that is used will come off usually by 2 weeks. If you notice swelling, bright red bleeding, or green discharge, you're going to contact your primary health provider. To clean the area, we're going to wipe gently with a soft cotton cloth, cotton swab, gauze pads, or plain water. To dress your baby, we want to just dress them as you would dress yourself. We don't want to overdress them because too much clothing and too many blankets can cause your baby to get overheated. In vaccines, we recommend that all infants should receive all recommended vaccinations. Do you have any questions for me? No? You're ready to leave? Okay.